Dear students, in previous session we have seen regarding tonicity. In that we have seen that when you are having any pharmaceutical preparation that comes in contact with your blood, it should have same osmotic pressure as that of the blood. And in that case, we are saying that the pharmaceutical preparation is in tonicity with your blood. When there is change in the tonicity, either hypertonicity or hypotonicity, it will create a pain or it will cause a discomfort. So in order to adjust this tonicity, it is important that to avoid this discomfort to the patient, once you are having that pharmaceutical preparation with you and you are consuming it, so when that is supposed to be injected into systemic circulation, and if that creates a pain, if that causes a problem, then in order to avoid this issue, it is important to adjust the tonicity of these pharmaceutical preparations. So there are various extemporaneous methods by which you can adjust tonicity of your formulation. If prepared formulation is hypotonic, then the tonicity adjusting agents are added, and at the same time, if formulation is hypertonic, then you need to dilute this solution by means of suitable solvent. So as the tonicity is less than isotonic one, you need to adjust that tonicity by enhancing it, and if your solution is hypertonic, having more tonicity than the normal, then you should need it to dilute. There are some common methods that are used, and the most common methods are for the adjustment of isotonicity are class 1 method and class 2 methods. So basically these are classified as the one where you are going to adjust tonicity by the use of tonifier. The class 1 method is again classified as cryoscopic method and sodium chloride equivalent method, whereas class 2 methods are known as White-Vincent method and Sproul's method. The Sproul's method is the modification of White-Vincent method. Let's see these four methods one by one. The first one is class 1 method. In this method, you will use sodium chloride or suitable tonifier to adjust the tonicity. Here also you can observe the freezing point depression caused by the formulation. Now see, when we are discussing about cryoscopic method, which is also known as freezing point depression method, at that point of time you can observe that the change in osmotic pressure when you are adding any kind of substance, that will result into change in osmotic pressure. But this change in osmotic pressure is quite difficult to measure in comparison with measurement of depression of freezing point. In previous session we have seen that you can easily observe or you can easily measure depression of freezing point that has been caused by the addition of drug substance. During physicochemical properties, we have seen the relationship between lowering of vapor pressure, elevation of boiling point, depression of freezing point and osmotic pressure. How these four methods are related with one another. So the change in colligative property of one will result into change in second colligative property. So it is quite easy to identify the freezing point depression caused by addition of a drug substance. We are sure that the freezing point of pure water is 0 degree Celsius, whereas freezing point of blood is minus 0.52 degree Celsius. So in order to adjust the tonicity, you are going to add a substance, that is sodium chloride, which will result into lowering of freezing point of your preparation equivalent to the freezing point of blood. So the quantity required to make your solution isotonic is dependent on how much amount of third agent you are going to add. So in order to have that, the mathematical expression you can deal with the actual concentration of given substance to the substance concentration required for the freezing point depression, and this you are going to correlate it with depression of freezing point of blood plasma. So from this you can easily calculate percent concentration of substance required to be isotonic with blood plasma, that is your X. For example, suppose if you are having 1% weight by weight solution of sodium chloride, so it will result into freezing point depression to the minus 0.576 degrees Celsius. So you are saying that this will amount required to make your blood isotonic. So if you are putting this value into the formula, then you can have the actual value as 0.9% weight by volume, because the 0.576 minus 0.576 value depression is because of 1% of substance. So by putting this value into the formula on your display, you can calculate X as the 0.9% weight by volume amount of NaCl required to make your formulation isotonic. So the next method is sodium chloride equivalent method. In this case, you will use 1 gram of drug. You are going to use sodium chloride equivalent to the 1 gram of drug, and the percentage required for the adjustment of isotonicity can be calculated by using percent strength of the medicament. So the value of sodium chloride in percent required for the adjustment of isotonicity is dependent on the equivalent quantity of sodium chloride and percent strength of medicament. So by this equation you can calculate the amount of sodium chloride required to make your solution isotonic. Okay, the next class for the determination of or for the adjustment of isotonicity is the method where you are going to focus on water that's supposed to be added to the drug solution in sufficient amount, because in case of hypertonic solution there is change in percent water uptake and percent water release, and in order to adjust this water volume you are going to add some isotonic buffered solutions which will maintain the equivalence between salt and water. So the two specified methods are White-Vincent method and Sproul's method. As far as White-Vincent method is concerned, in this method the water is initially added to the drug solution to make it isotonic, and the final volume of your solution is then further adjusted with isotonic buffered diluting vehicle. So this buffered diluting vehicle will be mixed with water based on the weight of drug that you are supposed to be converted into the solution, which will have isotonicity as that of the blood. So the equivalent amount of sodium chloride, that is your salt, because as in the case of hypertonic solution it is important to maintain balance between your salt and water. So the isotonic buffer diluting vehicle, the quantity of isotonic buffer diluting vehicle is estimated by the formula where you are going to have weight of drug and equivalent sodium chloride quantity. In the case if your solution contains more than one drug ingredient, then the volume of isotonic solution required is supposed to be by mixing of each drug with the water that is required to maintain the tonicity. The next method is Broll's method. As I told you earlier, it is the simplified or modified form of White-Vincent method. The earlier equation by the White-Vincent method is similarly used to calculate the required volume of isotonic solution. But in the case of Broll's method, in comparison with White-Vincent method, the value of W, that is weight of the drug, is kept constant. So for the most of ophthalmic and parenteral drug, you are supposed to take 0.3 gram of drug, and then based on that you are going to calculate the volume of the buffer isotonic solution required to maintain the tonicity. So these are the four methods which are used for the adjustment of isotonicity. The four methods are namely cryoscopic method, where you are going to focus on depression of freezing point. Instead of osmotic pressure, you will work on freezing point depression because of addition of a drug substance. And for the sake, if freezing point of water is 0 degrees Celsius, then you are quite aware that freezing point of blood is minus 0.52 degrees Celsius. And so as to adjust that tonicity, it is important that it should be in match with the freezing point of blood. The next method is your sodium chloride equivalent method, where you will require sodium chloride to adjust tonicity of the blood. So the isotonicity of your preparation, in order to match with tonicity of blood, you will add sodium chloride in equivalent quantity with the drug. The next method is White Vincent method, where you are going to add water in order to maintain the balance between water and salt. And for the sake, you will use isotonic buffered diluting vehicle, where you are going to vary weight of drug, equivalent quantity of sodium chloride, and in accordance with that you will have isotonic buffered diluting vehicle volume. The next is your Brawls method, which is known as modified version of White Vincent method, where you will keep value of your drug amount as the constant, and then you are going to further make changes as far as isotonic buffered diluting solution is concerned. So this was about various methods for the adjustment of isotonicity that are divided as a class 1 and class 2 methods. Thank you.